Hi, I'm Dr. Rocco Ciocca, and I initially trained as a general surgeon, was board certified in general surgery, but then did a fellowship in vascular surgery and became board certified in vascular surgery. And then the bulk of my career, I worked as an academic vascular surgeon at multiple tertiary care centers across the country, and actually was chief of vascular surgery at multiple teaching hospitals across the country. And during the course of that, and working somewhat synergistically between vascular disease and wound care, I also developed a very strong interest in wound care. And that correlates to a large degree with vascular disease, particularly peripheral vascular disease, diabetic foot ulcers as an example, venous stasis ulcers as another example. My training as a vascular surgeon really correlated quite nicely with wound care. And then also when I was medical director for wound centers that provided hyperbaric medicine, I've become certified in managing patients who qualify for hyperbaric care, and that carried over to being here, where we both provide advanced wound care and hyperbaric medicine. I chose wound care again because I think it is very strongly linked, at least a high percentage of the patients with chronic wounds are very closely linked with both peripheral vascular disease and venous insufficiency. So not an insignificant percentage of the patients that I was seeing for vascular disease also had chronic wounds. So there's a very close link. Now, not all patients with chronic wounds have vascular disease, but during the course of being a vascular surgeon, I spent a lot of time dealing with wounds, and also realized that providers who specialized in wound care were actually lacking, and very often benefited from someone who could focus not only on the comorbidities that lead to wounds, but the wound itself. The other thing that I think is a little bit unique about our wound center is that, one, we're right in the hospital itself, and that gives us the opportunity to provide both outpatient wound care, but also to consult with our colleagues and various other specialties to help them manage their patients who also have chronic wounds. You know, I grew up in New England, and I was fortunate to attend college here in Maine, and that really planted a seed of always having an adoration, if you will, for Maine and what it provided. And then we were fortunate to live and work all across the country, but there was always a desire to come back to Maine and settle down and enjoy everything that Maine has to offer, and it has a lot to offer.